Hi, my name is Zach, and today I'm going to be talking about how the digitalization of our new society will impact the nursing profession for the better and for the worse. In this video, I will describe ways in which technology and digital forms of nursing and medical care will benefit those involved. I will also describe some possible consequences of technology and what it may negatively impact in the world of nursing. To begin, it's best to see how far nursing has come over time, as modern nursing can be traced back to the mid-19th century when Florence Nightingale developed her approach to better care for soldiers during war times in Europe. She identified 5 environmental factors, the 5 factors being fresh air, pure water, efficient drainage, cleanliness or sanitation, and light or direct sunlight. Her 5 environmental factors helped improve health outcomes in the soldiers. Those themes resonate today, as the main objective of nurses today is about improving the health outcomes of their patients.
Nursing today is mainly practiced in hospitals at the bedside or in some sort of community setting. Yet many themes that nurses still apply to their practice today stem from Florence Nightingale back in the 1800s. Krisha and Marion state how nurses are focused on improving the health outcomes of their patients, forming meaningful relationships with them and their coworkers, along with providing the best, most efficient care possible for their patients.
With the continued development in technology, the nursing profession will become more and more different compared to where it was with Florence Nightingale and even just the past 5 years. As Krisha and Marion state, there is no aspect of our profession that will be untouched by the informatics revolution in progress, as continued progression in technology will change the way that nurses practice. With more advanced levels of technology, new ways of practice will be formed.
With increased development of new technology, nursing will start to change in ways where care can truly be improved. To start, health records can be stored and retrieved online, allowing for easier access to patient medical history by nurses, as having that quick access to the history of a patient in an emergent situation can be critical, as the history can contain important details that can truly help in that situation. Knowing their past medical history, any allergies they may have, or any medications they may take can truly be the difference between life and death in those emergent situations. Crick et al. Also explains how many studies have been done on the effectiveness of the EMR, as a large number of acceptance studies focus solely on the EMR, noting that they're effective. More efficient care can be given to patients when their medical history is easily accessible in the hospital, giving the staff a much quicker, more efficient way of knowing their background. Kelly also notes how the digitalization of patient data and information has created new opportunities to further improve care quality. Technology will also be able to assist in reducing the cost of healthcare and reduce the number of hospital-acquired infections. Rosemary Parr states, with the proliferation of digitalization and major advances in telehealth, technology is leading the way to address the economic crisis in healthcare delivery. With the technological shift, medical hospitals and facilities can see savings from many of the online services that can now be offered, such as telehealth appointments, where doctors or nurses can see their patient from the comfort of their own home over a computer or phone and assess them there. Parse also states how with programs being developed to monitor people 24/7 in their homes, these people are less likely to acquire any hospital-acquired infections. This care is also less costly and more efficient, as the patients can have their needs met from the comfort of their own home. Technology has its benefits in the field of nursing, but we must take into account some possible downsides of this technological advancement. Some nurses may lack the technical knowledge required, as Cantilla states that digital skills required to provide good patient care, including associated social and communication skills and ethical considerations of digitalization in patient care. Technological skills should not be looked at as a standard, as some nurses may not be technologically efficient. More education and training in technology would be needed for these kind of staff. Pepito and Loxon also state how there will be a loss of jobs, as there is already a robotic revolution occurring in healthcare, where robots have made tasks and procedures more efficient and safer compared to the human counterparts doing them as well. Lastly, hackers may uncover patients' medical records, as Protina states how in 2018, 15 million people had their medical information hacked. Many people for that reason are against the technological advancement in nursing and the medical field. To conclude, technology can do some incredible things for the state of nursing, such as reduce costs and prevent infections. But there are some downfalls, such as private information being online for potential breach. As a profession, we should continue to advance in technology, but maintain caution over how much technology we utilize in our nursing profession. Here are my references, and thank you for watching my presentation.